You might have diabetes and not know it. Hey everyone, welcome to Health Unraveled, where we unravel everything concerning your body and your health. Today we're talking about something that affects millions of people worldwide, yet many have no idea it's happening inside their bodies right now. We're diving into diabetes, specifically the silent symptoms that often go unnoticed until serious complications develop. Here's a shocking statistic: according to the CDC, over 8 million Americans have diabetes but don't know it. That's roughly 1 in 5 people with the condition walking around completely unaware. And globally, the numbers are even more staggering. So today, I'm breaking down the warning signs your body might be giving you, why diabetes is so dangerous when left untreated, and what you can do right now to protect yourself. Let's get into it. What is diabetes? Before we talk about the hidden signs, let's quickly cover what diabetes actually is, because understanding the mechanism helps you understand the symptoms. Diabetes is a condition where your body either doesn't produce enough insulin or can't use it effectively. Insulin is like a key that unlocks your cells so glucose from your food can enter and be used for energy. When this system breaks down, sugar builds up in your bloodstream instead of fueling your cells. There are 3 main types. Type 1 diabetes is an autoimmune condition where your body attacks the insulin-producing cells in your pancreas. This usually develops in childhood or young adulthood and comes on quickly with obvious symptoms. Type 2 diabetes is the most common form, accounting for about 90 to 95% of all cases. Your body becomes resistant to insulin over time, and your pancreas eventually can't keep up with the demand. This one develops slowly, which is exactly why so many people miss the signs. Then there's prediabetes, where your blood sugar is elevated but not quite high enough to be classified as diabetes. This is a critical warning stage that roughly 98 million American adults are living with, and most don't know it. Why people don't know? So why do millions of people have diabetes without realizing it? The answer is simple but frustrating: the symptoms develop gradually and can be incredibly subtle, especially in type 2 diabetes. Your body is remarkably adaptable. As your blood sugar slowly creeps up over months or years, you adjust to the changes. That constant thirst. You might just think you're not drinking enough water. The fatigue? You blame it on stress or getting older. Your body normalizes what's happening, and you don't recognize it as a medical emergency. Another major factor is that many early symptoms mimic other common conditions or just general tiredness from modern life. When you're juggling work, family, and everything else, it's easy to dismiss feeling run down as just part of the grind. Plus, type 2 diabetes often affects people over 45, though it's increasingly appearing in younger adults and even children due to rising obesity rates. When you're in that age range, you might attribute symptoms to aging rather than a treatable condition. The danger here is real. Undiagnosed and untreated diabetes damages your blood vessels, nerves, kidneys, eyes, and heart. By the time some people get diagnosed, they already have complications that could have been prevented with earlier intervention. The warning signs. Alright, let's get to the signs your body might be trying to tell you something's wrong. I'm going to break these down into the more common symptoms and the ones people often overlook. Excessive thirst and frequent urination. This is one of the classic signs. When you have too much sugar in your blood, your kidneys work overtime to filter it out. They pull extra water from your tissues to dilute the sugar, which makes you urinate more frequently. And all that urination makes you dehydrated, so you feel constantly thirsty. It's a vicious cycle. If you're waking up multiple times a night to use the bathroom or you're drinking way more water than usual and still feeling thirsty, pay attention. Unexplained weight loss. This might sound like a dream to some people, but unexpected weight loss without trying is a red flag. When your cells can't access glucose for energy because insulin isn't working properly, your body starts breaking down muscle and fat instead. You might be eating normally or even more than usual, but the pounds keep dropping off. Extreme fatigue. Everyone gets tired, but we're talking about a different level here. This is the kind of exhaustion where you feel drained even after a full night's sleep, where simple tasks feel overwhelming. Without glucose reaching your cells efficiently, your body is essentially running on empty. Blurred vision. High blood sugar can cause the lens of your eye to swell, changing its shape and affecting your ability to focus. Many people assume they just need new glasses, but if your vision seems to fluctuate or suddenly gets worse, it could be diabetes. Slow healing wounds and frequent infections. Do cuts and bruises take forever to heal? Are you getting recurring infections, especially urinary tract infections or yeast infections? High blood sugar impairs your immune system and reduces blood flow to tissues, making it harder for your body to heal and fight off infections. Tingling or numbness in hands and feet. This is a sign of nerve damage called diabetic neuropathy. Excess sugar can injure the walls of tiny blood vessels that nourish your nerves, especially in your extremities. It often starts as a tingling sensation and can progress to numbness or pain. Darkened skin patches. Called acanthosis nigricans, this shows up as dark, velvety patches of skin, usually in the armpits, neck, or groin area. It's a sign of insulin resistance and is more common in people who are overweight. Increased hunger. Even after eating, you might feel ravenously hungry. That's because your cells aren't getting the glucose they need, so your body keeps signaling that it needs more fuel. Now here's the thing, you might have just one of these symptoms, or you might have several. Some people have none at all, which is why regular screening is so important. Who's at risk? While anyone can develop diabetes, certain factors significantly increase your risk. Let's run through them. Being overweight or obese is the #1 risk factor for type 2 diabetes, especially if you carry weight around your abdomen. Family history matters too. If you have a parent or sibling with diabetes, your risk goes up. Age plays a role, with risk increasing after 45, though we're seeing more cases in younger people. Certain ethnic groups, including African Americans, Hispanic/Latino Americans, Native Americans, Asian Americans, and Pacific Islanders have higher rates of diabetes. If you've had gestational diabetes during pregnancy or gave birth to a baby weighing more than 9 pounds, you're at increased risk. Having polycystic ovary syndrome, or PCOS, also raises your chances. A sedentary lifestyle, high blood pressure, and abnormal cholesterol levels all contribute to diabetes risk. And if you've been told you have prediabetes, you're already on the path toward full diabetes unless you make changes. If you check multiple boxes on this list, it's even more crucial to watch for symptoms and get screened regularly. What to do now? So what should you do with this information? Here's your action plan. First, if you're experiencing any combination of these symptoms, schedule an appointment with your doctor for a blood sugar test. Don't wait. The tests are simple: a fasting blood glucose test, an A1C test that shows your average blood sugar over the past 2 to 3 months, or an oral glucose tolerance test. Even if you don't have symptoms but you have risk factors, talk to your doctor about screening. The American Diabetes Association recommends testing for all adults starting at age 35, or earlier if you're overweight and have additional risk factors. If you're diagnosed with prediabetes, here's the good news: it's reversible. Lifestyle changes can bring your blood sugar back to normal levels and prevent you from developing type 2 diabetes. We're talking about losing just 5 to 7% of your body weight if you're overweight, getting at least 150 minutes of moderate physical activity per week, and eating a balanced diet rich in whole foods, vegetables, lean proteins, and fiber while limiting processed foods and sugary drinks. If you're diagnosed with diabetes, don't panic. While it's a serious condition, it's manageable with medication, lifestyle changes, and monitoring. The key is catching it early before complications develop. Diabetes doesn't have to control your life, but undiagnosed diabetes will damage it. So please, take this seriously. Share this video with anyone who might benefit from this information. Check in with your parents, your siblings, your friends who might be at risk. And if you found this helpful, hit that like button and subscribe for more health content that cuts through the noise and gives you practical information you can actually use. Stay healthy, stay informed, and I'll see you in the next video.